talk to us. Thanks, Ian.
Thank you for this opportunity to be here. I'm going to present our study, the MS Smart trial, a trial that we are performing at UCL on secondary progressive MS patients. So, first of all, this trial has been founded by many partners, as you can see here. The MS Society, the MRC, the NHS. So let's start with a brief introduction on the disease course. As you know, the majority of patients usually have a relapsing remitting initial course with relapses and remission that can be complete or incomplete. And then 2/3 of all the patients after a few years enter into a progressive phase called secondary progressive, in which there is a steady progression of disability without any clear remission. And then there is, of course, a small percentage of patients, we can say 10 to 15%, that start with a primary progressive course. So they never have relapses and they accumulate disability with time without clear remissions. So, of course, to stop this process, we need drugs, and to approve drugs for clinical trial for a particular disease, we need a very long process. So we start with animal and wet lab experiments, in which a lot of molecules are tested for a particular disease. Then there are phase 1 trials in which the safety of these molecules are tested on a little group of patients or on healthy subjects. Then in phase 2 trials, there are also in general less than 100 patients that are tested with this particular drug, and in phase 2 trials we test both the efficacy of the drug, and we also identify the markers of efficacy, and of course we also look for the safety of the drug. Then we move to phase 3 trials, in which we really can test the efficacy of a particular drug. And then if the phase 3 trials are successful, then of course there is the approval of the drug, and then we enter into a phase 4 trial that is a post-marketing phase. This process, of course, is based on clinical trials. Usually clinical trials test the efficacy of a particular drug against a placebo, that is a dummy drug. In a classical clinical trial, we have generally 50% of patients on active treatment and 50% of patients on a dummy drug, a placebo. In our trial, the MS Smart, we used a multi-arm approach. It means that we are testing at the same time 3 different drugs, so treatment A, B, C, against placebo. So actually for a patient, there are more opportunities to be on an active drug as compared to the classical trials. In fact, a patient that wants to be enrolled into this trial will have 1 possibility out of 4 to be on treatment A, treatment B, treatment C, and only 25% of possibility to be on a placebo. We are testing 3 different drugs that we believe may have neuroprotective properties. The first one is amiloride, the second one is riluzole, and the third one is fluoxetine. They are not new drugs. In fact, they are used for different diseases, and we are trying to repurpose them. This is not a new concept, the repurposing of the drugs. One of the main examples is aspirin, that was originally used as an anti-inflammatory drug, but now is used for cardiovascular or cerebrovascular diseases. Another example is gabapentin, that was originally licensed for epilepsy, was an anti-epileptic, and now is used for neuropathic pain. Therefore, let's go. Let's have a look at these drugs that we are testing. So the first one is amiloride, and amiloride is currently used to treat high blood pressure. There are already trials, or very little trials, on patients with MS that are very promising. So amiloride targets a particular channel that is associated with the death of the neurons. Therefore, this is one of the drugs that we are testing, of course. And the second drug is riluzole. This drug is currently used for another neurological disease called amyotrophic lateral sclerosis. Also, this drug has many demonstrated neuroprotective activities, so we decided to test also this drug. The third drug is fluoxetine. It's a drug that is currently used to treat low mood, depression, and has two main neuroprotective properties. The first one is to increase the energy production within the neurons, and then the second one is to stimulate the production of a particular factor that is associated with the neuronal survival. So this should be clear. The main target of our study is the neuroprotection. So we want to demonstrate that these drugs can slow down the progression of disability in MS. So how can we measure, how can we say that these drugs can stop or at least delay the progression of disability? We have this marker, this particular marker called brain atrophy, that is basically the shrinkage of the brain. So the shrinkage of the brain, so this particular process called atrophy is correlated with the clinical progression and the progression of disability, of course. So we are able to measure, to assess the atrophy with a particular MRI scan that can give us the measure of the atrophy over time. Therefore, the primary outcome in our study is the brain atrophy, measured with the MRI. This is only a slide to say that in the first part, in the early relapsing remitting phase, we need drugs that can target the inflammation, so can reduce the relapse rate. In the second part, we need drugs that can stop the progression of neurodegeneration. Therefore, we need neuroprotective therapies. And unfortunately, at present, there is no proven treatment for progression. The brain shrinking can be imagined like a balloon. So the shrinkage of this balloon in healthy aging is about 0.2% per year. In MS is between 0.49 and 1.2% per year. In this study, in this trial, we are also performing sub-studies, very interesting sub-studies involving very advanced MRI scans and also biochemical markers. So let's go to the main inclusion criteria. Of course, we are enrolling patients with a confirmed diagnosis of secondary progressive MS with a steady progression of clinical disability in the preceding 2 years. We enroll patients that can walk at least 20 meters, even with a bilateral support, so a rollator, crutches, it doesn't matter. We can enroll patients between 25 and 65 years, and unfortunately we cannot enroll patients on antidepressants, especially patients on SSRI, such as fluoxetine, citalopram, and sertraline. And we cannot enroll patients with significant organ comorbidity, such as cancer or renal or hepatic failure. Of course, the patients in this study cannot be on immunosuppressants or disease-modified treatments. And for safety reasons, we cannot enroll patients with glaucoma, epilepsy, or depression. So what happens if you are interested in this trial? We will be in contact with you as soon as possible to check your eligibility. So we usually perform a pre-screening telephone interview in which we ask you a few questions to check your eligibility for the trial. Then, if you are potentially eligible for the trial, we give you an appointment, of course as soon as possible, to be formally assessed at the study center. And then this is the trial, the 2 years of our trial. So in the beginning there is the screening visit and the baseline MRI scan. If both these two, the visit and the MRI scan are okay, then we give you a baseline appointment in which we perform a very detailed clinical assessment, and after the baseline visit you start the drug. You start with 1 capsule once daily for 1 month, and then if it's well tolerated, you don't have side effects, you can increase the dose to 1 capsule twice a day, and we perform another MRI scan after 6 months, and then the third MRI scan after 2 years. After 1 year, there is another very detailed clinical assessment that is also repeated after 2 years. Therefore, considering all the visits, you will have 8 clinic visits in the first year, and then 3 clinic visits in the second year. There are a lot of centers in the UK that are actively enrolling patients. The main centers are UCL and Edinburgh, and the enrollment will continue till the end of 2015. The target is to enroll 440 patients, and this of course will give a good strength, a good power to our study, so we can of course the conclusions will be stronger if we have more patients. And at present we already screened 80 patients at UCL, and 60 of them are already on a drug, on one of the drugs for the trial. I just want to tell you that if you are interested, you can check the website, and or alternatively, you can also send us an email if you want to be contacted. We are happy to call you and discuss in detail the trial. I want to thank you for this opportunity, and of course we will stay here, so if you have any question, we are happy to answer. Thank you.
Thank you very much for Now, all of that information is obviously going to be on the website, so if you missed any of it or you wanted to look at it again. I hadn't actually realised that we were recruiting for a trial, but that's lovely. So for anybody with secondary progressive, that looks like it might be interesting. So now we're going to move along, because Gavin's still not here, but he won't be long. Dr. Monica Marta, you're going to talk about add-on therapy to slow down secondary progressive. This is going to be interesting too. Right, so Dr. Monica.
Thank you, thank you. Can you find it?
No, just